Money, money, money must be funny in a rich man's world. Guess who's back? Mwah. Guess who's drinking coffee at 9 o'clock at night? Mwah. Ello Lovies, welcome back to another video. My name is Hannah. Can you tell what my favorite Christmas gift was this year? It's my alpaca fur hat. So soft. Honestly, she's gonna mess up my blowout that I just did, so I'm gonna take her off. But hello, lovies. Welcome back. I thought this week I would continue the discussion of quit romanticizing dysfunction, but now zoom in on plastic surgery, because it's a new year. And a very famous saying that really pops up around this time is new year, new me. And then these companies that capitalize off of men and women's insecurities use that saying to try and lure individuals into having procedures done, aka marketing off of body dysmorphia and individuals' insecurities, point blank period. So today I'm gonna try and be a different voice. I feel like whenever I see a video on YouTube that's advocating against plastic surgery, it's normally a girl who takes a famous celebrity who's had plastic surgery, allegedly or not, like they're open about it, and they're absolutely belittling, bullying, and bashing the girl. And the only reasons that are given to why you shouldn't do it is because it makes you look older, because it just does nothing for you, you're just paying for the celebrity's face, which are like somewhat valid arguments in today's discussion, but that's not good enough. That's not good enough for an individual like me who wants to know the science behind, well, why isn't this medically good? Why isn't this psychologically good? Why is this societally not good? So today, I'm going to not only educate you on the history of plastic surgery, or truly reconstructive surgery and procedures, but I'm going to slightly delve also into what these procedures entail. And by delve, I mean give light synopsises, kind of explain the medical, chemical-ish. So I'm going to give you a trigger warning right now, right here. That today's discussion includes topics that revolve around medical procedures, needles, surgeries, and body dysmorphia. So if any of those topics are triggering, if medical talk, medical language is triggering to you, I'm kindly advising you and urging you to click off. Congrats, you got the golden ticket, you can go. I won't take personal offense to it. I'm making this video in hopes of giving more people a better medical education, or like general medical education in regards to plastic surgery, because I do feel in America, whether it's with plastic surgery, whether it's with just general health, going and seeing your everyday physician, or whether it's with other procedures that involve chronic disorders and illnesses, just in general, the average individual in America suffers from lack of general medical knowledge. So I'm hoping to be a voice that educates and fills in some more blank spaces that people want to know knowledge on. It's the best way to put it. If you want to know the truth to what Botox is, I'm here to tell you that. If you want to know how reconstructive surgery came to be, I'm here to tell you that. I'm not going to show any graphic pictures. I'm not going to show any procedure pictures or videos or nothing like that. I'm not going to show any anatomy pictures. You can Google that in your own free time. And I do want to say, before I even delve into this, do I have a medical degree? No. Did I ever go to medical school? No. Is that a journey I want to pursue? No. I grew up with a mother for a doctor, so medical language is very much just normal to me in my everyday life. I have always had medical speak, so to say, or talk around me consistently. So being raised by a physician makes me kind of a medical nerd by default. And I'm already a history nerd. So this video was so fun to really put together. And now I get to share it. So let's delve in. My key focus for today is I'm not here to talk down on anyone who's undergone plastic surgery or is thinking about undergoing a procedure or surgery of any sorts. Your body, your choice. Your body, your business. I'm not judging. I'm merely just trying to be an advocate that natural beauty is still beautiful. I want to address and educate how in today's society, capitalizing off of body dysmorphia, or to break it down even more, individuals' insecurities is so normalized, is highly encouraged, and is genuinely erasing people's uniqueness. It's erasing people's features that show their ancestry, their emotions, their age. And it's not new. I'm about to break it down. It's not new. Capitalizing off of people's insecurities has not been new, but how highly societally praised it's become, that's new. That is very much new. And it sickens me today to think that for centuries, so many individuals have had their insecurities profited off of, but not in regards of people back in 600 BCE were getting a reconstructive nose job, what is now known today as a rhinoplasty, because they wanted a new nose. It was because they were born with a disorder of sorts and they wanted a better quality and quantity of life. So they kind of risked their lives in the name of medicine for the sake of advancing medicine and also in hopes of advancing their own life. And the fact it has just so switched today and is now one of the industries that is slowly poisoning men and women is so sad to me. Just like how women were marketed makeup with lead back in 4,000, 3000 BCE, and really up until the 1930s, arguably 1940s. Now women are being encouraged, and men, to undergo procedures in which injects them with a toxin and harms their quality and quantity of life overall, rather than benefiting it in the name of being societally accepted more. I really want to break down how originally reconstructive surgery or plastic surgery was a medical necessity. It was only done for war victims and individuals born with birth defects. And by birth defects, I mean cleft palate, pinned back ears, webbed hands or missing digits, deviated septums, and something called craniofacial issues, which is when an infant is born and the brain's platelets fuse too soon, and that's why babies have to wear those cute little helmets today. Oh my god, they're so freaking cute! They're so cute, but it's so sad because they have craniofacial issues, and that's how we help them. And now I'm talking baby because I'm just thinking about how cute babies are. I have baby fever so bad right now. So initially, individuals that underwent reconstructive surgeries from 600 BCE up until 1947, and even a little past 1947, I'd argue up until the 1970s, were doing it in, one, hopes of advancing medicine, knowledge, and techniques, and two, to be able to normally eat, speak, and function in society, because society would exile those that looked different. Something we know today that hasn't changed. And individuals chasing youth and societal approval is nothing new. It is so common a theme in so many mythologies of individuals chasing the fountain of youth, chasing to be immortal. So this is an issue that has just progressed and evolved over centuries. Going back to the beginning, to break down the history, as I have mentioned earlier, reconstructive surgery actually started in India, or what we have immense documentation of, during 600 through 800 BCE. And one of the most famous Indian surgeons that was the father of plastic surgery was an Indian surgeon named Sushruta. And he wrote in his book, Sushruta Samhita, all about reconstructive surgical procedures as well as ancient traditional medical techniques. So his book is kind of one of the first textbooks on not only reconstructive surgeries at the time, but also just Eastern traditional medicine. And it's one of two very, very infamous and famous ancient texts we have today. His book really focused on skin grafts and what we now know modernly today as rhinoplasties. And he developed the Indian method, which is just taking skin from the forehead to reconstruct the nose and make it more functional. I do want to highlight, and it's like kind of tapped on earlier, individuals that got what we know today as a rhinoplasty also were getting it in hopes of a septoplasty. So if you were getting reconstructive nose surgery, it was for deviated septums or other birth defects that involved the nose. It wasn't strictly because you wanted a new nose. It was because you endured an injury as a kid, your nose got broken, you grew up, and then you had a deviated septum, and you wanted that fixed. And the only way they knew how to do that was by taking the whole nose apart, okay? That's that. And his works, of course, spread out. He inspired the Italian surgeon in 1597, Gaspare Tagliacocci, who wrote the De Curtorum Chirurgia per Inciti Omnem. I'm going to be pronouncing a lot of things phonetically. In Italy, the Italian method, which was, hey, let's not take skin from the forehead, why don't we take skin from the elbow, from the arm, during reconstructive surgery? And thus, Gaspare was named the father of plastic surgery, or reconstructive surgery, at the time. I do want to say, rhinoplasty, the word itself, was not a coined word until 1818, and it became a coined word through the German surgeon in 1818, Karl Ferdinand von Graff, who published significantly multiple works on the rhinoplastik in his book Oder die Kunst den Verlust der Nase organisch zu ersetzen, in which he refined both the Indian and Italian method and gave his 2 cents on how he thought rhinoplasties should be done, or the rhinoplastik. So this established him as a major pioneer in nose reconstructive surgeries and what we know today as the rhinoplasty. And I'm just going to throw another ball and hit it out of the park real quick because I think this is a cool fun fact. In 1827, Dr. John Peter Mettauer was the first American surgeon to successfully perform a cleft palate surgery, in which corrected an infant's cleft palate or an individual's cleft palate. Not saying he was the first to get it done, but he was the first to do it successfully in America. I just wanted to give someone their flowers real quick. So going back to what I was saying about rhinoplasties and septoplasties were one and the same during 600 BCE up until around 1902-1904. It wasn't until the late 19th and early 20th century that a rhinoplasty and a septoplasty became 2 separate procedures. Most notably, in 1887, Dr. John Orlando Rowe distinguished the path of performing a rhinoplasty strictly internally. And then in 1902, Dr. Otto Freer created the method of Freer elevator, as well as the Freer nasal knife used to cut cartilage in the nose, which is a method in septoplasty. So instead of reconstructing the nose, he said, hey, what if we just did this internally with my method. So rhinoplasty and septoplasty are becoming two separate procedures in 1902. And furthermore, surgeon Gustav Killen in 1904 created the Killen method, which is still a method used today. It is a submucose resection SMR method, or for all my doctor nerds out there, the L-shaped method, in which preserves about 1 centimeter of cartilage from dorsal top to bottom, for nasal support, forming the basis for the modern septoplasty. In 1934, Dr. Riethi introduced the concept of an open rhinoplasty, and in 1947, Dr. Cottle introduced a technique used to preserve the septum, thus highlighting the difference between the two surgeries. So, solidification of the two surgeries happened in 1947 through Dr. Cottle, i.e., it is from 600 BCE up until 1947, a rhinoplasty was combined with a septoplasty and strictly a medical procedure performed in order of hopes of not only reconstructing the nose to not look disformed, but correcting deviated septums. Reconstructive surgery really took off after World War I, and really during World War I, when soldiers were returning from war with immense warfare wounds, such as trench wounds, i.e. trench foot, shrapnel wounds, gunshot wounds, burns, gas exposure, wounds and burns, so much. So skin grafting really took to mean something entirely new. Not that it wasn't being done, because war has been a thing since 4000 BCE, when societies switched from agricultural to cosmopolitan, meaning from going from an agricultural mindset of protect the clan to building empires and battling others, so we became more animalistic. That's a discussion for another day. But World War I was the groundbreaking point of anesthesia evolutions and also skin grafting evolutions, which is so important because these soldiers, on one hand, were wanting to be societally accepted, but they were getting these procedures done to be able to eat again, to speak and talk normally, and to not be exiled from society. They did not want to lose their humanity, what they looked like. They weren't getting an entirely new face. They were hoping to have their faces and their bodies restored to them. And I really, really, really want to just hammer that in today, because that context matters immensely. Because it reminds us that this field began as medical necessity, not aesthetic optimization. And when we pretend surgery, these plastic surgery procedures are just self-care, we erase its origin and survival medicine and blur an ethical line. It wasn't until the 1980s and 1990s that plastic surgery became cosmetic. In the 1980s, there were more instances of women getting Botox done, or fillers even injected into their lips and cheeks. And really, as Hollywood rose in the 90s and early 2000s, it was normalized and pushed. Women were undergoing nose procedures as young as teenagers getting their parents to sign off and getting reconstructive nose surgery at 16. And Botox, medically, was created in 1970 to help individuals who suffered from seizures and strokes and their aftermath effects of developing muscle spasms and eye disorders. Botox was not invented with the intention of being used to prevent aging, as Botox itself is a neurotoxin that causes muscle paralysis. And so individuals who have a stroke sometimes lose the capability to control their grip on things. Their digits will go in and their nails will dig into the palms of their hands. So they'll inject it into the hand muscles in order to alleviate said muscle spasms, as well as other places. It's an agent now more notably also for TMJ. So now let's kind of break down different medical procedures, different surgical procedures, and I'll save my rant for on everything for the very, very end, because I just feel like it's important to educate first before I advocate and then integrate. Botox is a great example of how people treat it like it's new and harmless. People treat it almost like it's a skincare or self-care essential, and Botox is derived from botulinum toxin, one of the most potent neurotoxins known to science. So medically, it was first used mid-20th century for muscle spasms and eye disorders, and later approved in the early 2000s to be used cosmetically. This mechanism matters because it shows that Botox works by blocking nerve signals to the muscles, essentially creating a temporary paralysis, as I've said. And that paralysis is why wrinkles smooth out, but also when it's repeated so much, weakens the muscles. And the more the muscles weaken in your face, the more they sag. So Botox is a procedure in which kind of over time pushes you to undergoing a whole facelift, which is when they pull back the muscles, chop them, and try and make them firm again. So from one expensive procedure, you're being urged into undergoing another more expensive procedure, since Botox is slowly killing the nerves and the muscle structure in your face. And this alters people's facial expressions, the way they show emotions, and also on a neurological level changes how the human psyche processes emotions, both psychologically and physically, because when you smile, that signals to your brain, oh, we're happy. But when you're stuck like this and you can't really show emotion, your brain's confused. What are we feeling? What? I feel like we should be feeling this way, but we can't, because your muscles signal to your brain how you feel. So there's not just growing evidence that it is harmful to the muscle health and your nervous system's health, the neurological function as well. It is harmful to the human psyche as well. And it's because it's interfering with your nervous system and how it communicates, which is really scary, really dangerous. When your nervous system doesn't know how to communicate, you're in for a lot of psychological warfare. So let's go even further into the dysfunction conversation, because most modern fillers aren't dissolvable. They migrate, and even the things used to dissolve them are toxic. So it's just toxin on toxin. While most fillers are hyaluronic acid based, the hyaluronic acid used in them is not of the same chemical makeup that our body produces. So our bodies naturally produce hyaluronic acid. I think the best example I can give to this is just like how birth control is not the same chemical estrogen, progesterone, testosterone that the body makes. It is a synthetic compound. That's what fillers hyaluronic acid is. It's a synthetic chemical compound. So it doesn't match the body's chemical makeup. It is simply a chemical made to mirror and try and get the body to mimic it and build off of it. So going back to fillers can migrate. They can also compress blood vessels in the body and cause chronic inflammation throughout the body. And worst case scenario, lead to tissue damage or blindness. When you get under eye filler, that is one of the most dangerous procedures to be done. You have to sign a waiver saying, if I go blind, I cannot sue you. And a lot of plastic surgeons won't do it because the filler can just straight up migrate to your eyeball and cause you to go permanently blind, and it's irreversible. You can't dissolve it and gain back your eyesight. Once you lose your eyesight, you lose your eyesight. These injectables aren't just sitting passively in the body. They are constantly causing an inflammatory reaction, and I'll kind of break that down when I'm going into the vial shelf life of all these chemicals and toxins. Industry tends to frame the negative outcomes as rare, but in all honesty, it's just highly underreported, the symptoms and aftermath women experience, or just downright dismissed to keep the industry alive. A lot of individuals experience complications and then are, among women especially, socially conditioned not to complain once they've gotten the cosmetic procedure. Like, oh, you did it to yourself. And that's another thing and why I want to make this video, is because we shouldn't shame women who get plastic surgery. There's just no point. No point. If a woman gets a procedure done and she herself says, oh, I regret that and I'm experiencing this, there should be no, well, I told you so. There should be, how can I help? Let's address this problem. Let's figure out a solution. I just have to quit shaming women. Give yourself grace. If you're sitting here right now like, oh my gosh, why did I do that? Give yourself so much grace, and I'll dig into that later. I will dig into that later when I talk about body dysmorphia. But first, I'm going to talk about the body's shelf life of these chemicals. Botox, a neurotoxin. Most people, it lasts 3 to 4 months in the body before the muscles gradually regain their movement. Some individuals, the effects can be closer to 2 to 6 months. And this all depends on how an individual's body metabolizes and their muscle strength. If you have a faster metabolism, it's going to metabolize this toxin faster. If you have a slower metabolism, it's going to metabolize this toxin slower. And it also depends on how often these women are being treated. If you're going in every 2 weeks, every 2 months, you're going to have a slower metabolization to it and ultimately greater drooping effects if you were to cold turkey and quit. You have to kind of stay on top in order to avoid said muscle paralysis undoing itself and muscles regaining movement. Derma fillers, I'm going to break these down chemical for chemical, vary a lot more because they're not chemically the same makeup as Botox. Hyaluronic acid fillers, so lip fillers, cheek fillers, such as Juvederm and Restylane, that's normally 6 to 18 months in the body, depending on your metabolization. Calcium hydroxyapatite, IDEST, i.e. RAD-ES, is around 12 to 18 months, depending on your metabolization. Polylactic acid, IDEST, i.e. Sculptra, can last around 2 years, as it is a chemical in which is synthetic collagen attempting to stimulate your own collagen growth. Go back to my birth control metaphor, not the collagen we produce, but a chemical synthetic compound that's trying to get your body to want to produce more. PMMA, which is a semi-permanent filler, i.e. Bellafill, can last several years in the body. So in short, Botox on average lasts 3 to 4 months in the average individual's body, and fillers can last 6 months to 2 years. But let's talk about these chemicals' vial shelf life, because I feel like if I didn't, I would be missing such a great point out moment. Botox and other neurotoxins, such as Dysport and Xeomin, are actually very fragile chemical compounds. Unopened vials typically have an expiration date of around 18 to 24 months once they've left the manufacturer. And that's only if they're kept refrigerated from manufacturer and physician's office the entire time. That sounds long, but once a vial is reconstituted with saline, the clock changes so fast. Officially, manufacturers say that it should be used within 24 hours if it's refrigerated, and in real-world practices, some clinics try and stretch that to a few days, which is where ethical gray areas come in, and also try to use multiple vials on different women. And this is a big problem because once a vial is opened, the potency drops as well as its effectiveness. Thus, an individual who you inject with a fresh bottle is going to have way different effects than an individual you've injected with the same bottle a day later. And really, you're ethically not supposed to do that. You're supposed to use one vial on one person in that 24-hour period. So, the fragility matters because Botox isn't just a product. It is a living neurotoxin protein that has a 24-hour vial life, and if this is ignored, the potency drops over time, meaning weaker results and also unpredictable outcomes. You don't know how that chemical change is actually going to affect the next individual. And people don't realize that a lot of clinics take that risk to avoid paying more for the product, and overbooked clinics will look for cheaper options. So a lot more people are at risk that get Botox than we think. Fillers are more chemically stable, but not immortal. Most hyaluronic acid fillers, as in Juvederm and Restylane, have an unopened shelf life of about 1 to 2 years if refrigerated, or if stored properly, I should say. Once opened, they're intended to be single use, just like Botox. Any leftover product should be discarded, not saved, or used on any other individual because contamination risk skyrockets. Reusing or saving filler is a huge red flag. Even if people don't want to believe it happens more frequently than we like to imagine. Biostimulatory fillers like Sculptra or Radius also have an expiration date of around 2 to 3 years unopened, but once mixed or prepared, they have a much shorter usable window, sometimes hours, sometimes days, depending on the product. Meaning, once they're chemically compounded and or used, they have a vial life of anywhere from 1 to 6 hours or 1 to 7 days. That's a little terrifying. And the quiet truth here is these substances are not timeless beauty elixirs. They're perishable medical products, chemical compounds that require strict storage, timing, and handling. So when cosmetic culture treats these injections as casual maintenance, just drop in on your lunch break, it hides how technical, delicate, and medically serious this actually is. Notice when I was talking about vial shelf life, I said these chemicals had to be refrigerated, meaning they're not meant to be in our naturally warm bodies. The human body runs a temperature anywhere from 94 degrees Fahrenheit to 97 degrees Fahrenheit. We are naturally warm-blooded beings. So what causes these inflammatory reactions are chemicals leaving their cold Antarctic home and being injected into a warm body being. Thus, the lips swell, the cheeks swell, muscles paralyzed. It's not like putting on makeup. It is injecting a toxin into your body and calling its side effects or its aftermath cosmetic instead of medical. That is a big point I want to hit home. If we're calling a plastic surgeon's office a med spa or a clinical spa treatment, we live in a dystopian society. I was freaking out when I got my septoplasty. That's not a cosmetic treatment. I was freaking out. Anesthesia does not sound relaxing to me. It was not relaxing. It was not a relaxing experience to be put under an anesthetic. It's not a relaxing experience to go under the scalpel or to have a needle poked in you. Like, that is such a stressor for me. I was rocking back and forth in the car. The fact we have normalized that type of labeling, we live in a dysfunctional society, we live in a dystopian society. Eject button hit, I'm out. Moving on though, to breast implants. Breast implants, both silicone and saline, are very different from Botox and fillers, as they are just downright biologically different. They are foreign bodies that are placed into the chest cavity, and the chest or the body doesn't accept them at all. Nobody's body says yes when it gets saline or silicone put in it. It always walls them off with scar tissue, and in some scenarios, or over prolonged time, calcium buildup, and that's what causes hardened breasts. Scar tissue such as capsular contracture is an immune response doing its job. It's your body doing its job and trying to protect itself from foreign bodies, foreign objects. This is what leads to many women experiencing calcium build around scar tissue, thus causing the implant to harden. It's why implants over time can rupture, leak, shift, or cause chronic inflammation, and overall why breast implant illness is a real thing, because a breast implant procedure, or surgery I should say, is not a one and done deal. On average, a woman who has a breast implant done should go in every 10 to 15 years to get new implants, or even sooner, as in 5 to 7 years. And this is so important because breast implant illness is fatigue, rashes, joint pain, brain fog. So for years, breast implant illness was dismissed and called psychosomatic, but now, since so many women have outspoken about having fatigue symptoms, rashes, headaches, joint pain, brain fog, it is now a medical diagnosis, and that means you have to undergo medical maintenance. And even if you don't have breast implant illness, you are expected as an individual with breast implants to have medical maintenance over a certain period of time, which is very, very scary because it means more surgeries, more anesthesia exposure, more scar tissue buildup, and this is all framed as a confidence boost. And it's so expensive! And that's dysfunction being sold as empowerment. Point blank, period. Long-term anesthesia exposure can lead to cancer, liver failure, dementia. It can lead to respiratory problems. It can lead to autoimmune problems. It can lead to psychological issues such as brain fog, memory loss, or as I said, dementia, Alzheimer's, and downright strokes. There are so many instances now of surgeons dying young from Alzheimer's, dementia, strokes, and seizures because of anesthesia exposure. And so, if you're an individual constantly going under anesthesia, you are equally at risk as a long practicing doctor, if not more, because you were given a whole dosage versus a doctor or surgeon is just getting whiffs over a longer period of time. Now moving on to rhinoplasty, and I'm going to include septoplasty because I kind of want to talk about my journey briefly, but I want to be clear on that. I have nothing against individuals getting a septoplasty. I myself have gotten one, because a septoplasty is strictly a medical procedure in which corrects a deviated septum. It is not a cosmetic procedure by any means. However, it can cosmetically alter the way your nose looks. A lot of people are born with a deviated septum. Other deviated septum cases come from early traumas to the face or later traumas to the face, meaning as a kid you broke your nose, or while playing sports during high school or college you break your nose, and then you have to undergo a septoplasty to correct that. Unless you shatter your nose, then it's a rhinoplasty. My septoplasty happened because when I was 4, I fell onto the kiddie play table I had, and when you first break your nose, it doesn't always bleed. The bone will just shift, especially when you're young, because your bones are more malleable. They're more prone to just snapping and then continuing to grow that way. So for 19 years, I lived breathing out of a broken nose. When I went into my ENT's office at age 22, this past fall, I finally learned just how deviated my septum was from that early childhood trauma. On my right side, I was 65% deviated, and on my left side, I was estimated to be 85% to 90%. Septoplasty is medicine, full stop. It is just correcting a deviated septum. It restores breathing, it restores oxygen flow, it restores your quality of life. That matters, and it deserves to be protected from being lumped into the cosmetic critique, even though it can cosmetically change how your nose looks, since it is correcting a trauma in most scenarios. But I want to make that clear before I break down a rhinoplasty, because I'm not anti-surgery, I'm anti-misuse. This is where rhinoplasties come into the discussion, because the nose becomes a perfect example of how medicine and beauty culture are now blurring immensely. A procedure that can begin with a legitimate functional reason of concern, i.e. being breathing, oxygen flow, quality of life, is now becoming an aesthetic conversation due to cultural pressures that have grown louder. Suddenly the question shifts from, can I breathe, to, does my face fit the standard? What standard? What is the beauty standard? Please define it, because it's always changing to me. I think throughout history it's also always changing. That's not an individual's moral failing. That's conditioning. I'm not saying a cosmetic rhinoplasty is evil in any means. I'm asking why we've built a world where fixing a deviated septum often comes bundled with reshaping the face, which is where people feel they should fix it while we're already in there. That phrase alone says how normalized optimization has become. Scarily. I'd also like to gently point out that noses aren't just cartilage. They're cultural, they're ancestral, and they're expressive. When we flatten them into trends, we lose something intangible, but so real. Again, not blame, just bringing awareness. So a septoplasty treats a body that can't function. A rhinoplasty treats a culture that can't tolerate difference. Confusing the two is where harm begins. And now this leads me into our final discussion of body dysmorphia disorder. Body dysmorphic disorder, BDD, isn't just vain or insecurity. It's a real mental health condition where the brain is fixated on perceived flaws, often minor or imagined, but in whole become an individual's greatest focus. I'd like to highlight the feedback loop that cosmetic procedures cause neurologically. A temporary fix equals long-term unrest. Botox smooths wrinkles 3 to 4 months. Fillers add volume for 6 to 18 months. Breast implants might last you a decade, but none of these change the underlying self-perception. In fact, people often notice new flaws or imperfections the moment the first change settles in, and in some cases develop even more extreme BDD because they regret changing what was comfortable and normal to them. If you want to see girls break down on the internet about how they hate their new nose, literally look up "I hate my nose job," and it is so sad to watch. So many women cry, or young girls, about how they just wish they had their old nose back. They wish they had their ancestral nose. They wish they had their uniqueness. The more one adjusts their body, the more their brain is messed with. The brain recalibrates. Each procedure can intensify hyper focus on flaws, and faces that were fine before now may be scrutinized more harshly. And this isn't a moral failing, it's a cognitive phenomenon. So society amplifies it through social media, through filters, and cultural beauty norms make it easy to fixate on what's next instead of what's real. Cosmetic interventions become a cycle, not a solution. As I have lightly touched up on, a lot of these procedures you have to continually keep having done over periods of time in order to keep the effects remaining consistent. Arguably though, they will not remain consistent because your metabolism is always trying to fight them. So cosmetic procedures promise control over how the world sees you, but they really can't change how you see yourself. Often, the more we adjust, the more our perception to enough slips away, and the short-lived physical fixes result in being longer-lasting psychological consequences. Thus, there is no vial, there's no procedure, there's no needle, there's no scalpel, there's no pill, there's no injection. There is nothing that can give an individual confidence beyond an individual's own will. You have to love yourself and view yourself to be beautiful and all your flaws and uniqueness in order to not view yourself to have flaws or imperfections. In a world where it is so normalized and praised to change your uniqueness. I really want to give some advice 13-year-old me was given. I remember being 13 and talking to one of my friend's moms about how I wanted my jaw shaved. I wanted a rhinoplasty. I wanted my bump shaved, which actually just went away once my deviated septum was corrected because it was a broken bone. How I wanted preventative Botox, even though that is such a myth because it's just actually causing your muscles to droop more. And she told me, Hannah, there are girls out there paying for your natural born features. Why would you pay to have another's face? And that stuck with me. Because upon that discussion and talking with my mother about, well, do you know what these procedures actually are? I really have thought about it and come to realize, yeah, paying to look like another person will not guarantee me their happiness or my perception of their happiness or success, nor will it guarantee me that I'm actually societally accepted and favored. I'm just paying to look like another person. And that's so sad that we're praising that over praising individuals' uniqueness. Although I'd argue there is now a rise in praising individuals' uniqueness, but it is a small rise. And it's more rare now to be natural than artificial. If you take anything from my video today, let it be, it's beautiful the way you are. You are so beautiful the way you are. You are so beautiful with wrinkles, with freckles, with a big nose that shows your ethnicity or a tiny nose which shows your ancestry. Everyone's features are so, so beautiful. Everyone is so unique. And we've created a world where aging is treated like moral failure, where women are told empowerment looks like erasing evidence of having lived, where immortality is still sought after in youth, and where insecurity is monetized under the language of choice, while the pressure to conform is never acknowledged. When everyone around you is suddenly augmented, opting out starts to feel like neglect rather than autonomy. And the point of me saying all this is, again, not to shame people who have had work done or thinking about getting work done. That's not the point. The point is asking why the demand has exploded, why perfectly young faces are being altered, why preventative Botox exists even at all. Prevention of what? Time? Humanity? Emotions? What? We all have insecurities, but our insecurities are what make us unique and what others grow to love about us or already love about us. It's just a reminder of our ancestry. It's a reminder of how well we've lived life. It's a reminder of how expressive we were and how much joy and laughter we've had. So just remember, the very thing you may be insecure about is a reason why another absolutely adores you and or paying to have done to themselves. And in a world where everybody is paying to look the same, why not stay unique? It won't exile you from society at all. I can promise that. I myself have never had plastic surgery done. I've not been exiled. I'm not making this video from an island. I'm just choosing to be an advocate for natural beauty because it's so sad to, in retrospect, look back on how impressionable I was at 13 and wanting to alter my face, my body, and how normalized that was by society. Even though you can argue there is still so much scrutiny around individuals who undergo plastic surgery, it is widely more praised and accepted. There are too many 18-year-olds, the second they turn 18, getting their nose done, getting fillers, getting breast implants, all because they want to fix something wrong with them, when it's really just society capitalizing off body dysmorphia and insecurities. That was my video. I hope this is less than an hour and 20 minutes. I really just wanted to be another advocate for stay natural, and I want to change the discourse around plastic surgery to not be a blame, shaming, bullying discussion in which we take an individual, put them on stand, and put them on trial, and just belittle them and scrutinize them. So that's not gonna end this cycle of capitalism profiting off of insecurities of both men and women. What's going to change it is through educating and spreading awareness to what these procedures actually entail, what these chemicals are, giving more of a medical education to the average individual, because it is so sad how much of society lacks medical education, or general medical education, in fact, and hoping others integrate this and continue to educate and advocate alongside me. And if I must ask one final question, why would you put something poisonous in your body? If your argument back to me is, well, everything can kill you nowadays, everything is toxic and poisonous, that is such a weak argument that completely negates what I'm truly asking, which is, why are you allowing society to pressure you into your insecurities being capitalized off of? Why is body dysmorphia being capitalized off of and normalized instead of praising people's uniqueness? So sad. But that's all I have to share today. I promise the next video will be a little lighter while I work on quit romanticizing dysfunction, alcohol and food addiction. I want to kind of really work on that and make sure my language is precise and gentle, because when we talk about diets and alcohol in general, it is a really touchy topic for a lot of people. Almost touchier than politics and religion. Because just like how this topic talks about conscious consumption and choices, so does that one, even to a more magnified level. So I think I'm just going to post some lighter videos, but I wanted to start off this new year talking about plastic surgery, because it just felt so fitting, since a lot of people have New Year's resolutions. I encourage you to make one of them, to be an advocate and informant against the plastic surgery industry, and an advocate for natural beauty and loving yourself and building confidence and immense self-love. Because that is the only way you heal BDD, is just having immense self-love for yourself, giving yourself grace, immense grace, because we're all human. We all do things that we regret. We all do things or think things that are harmful to us, that may have been told to us by another, or maybe we're just telling ourselves. So we need grace on both ends. And at the end of the day, we just need to hug and love ourselves how we are. And be proud of our ancestry and our ethnicity and what makes us unique and different, and what our bodies do over time, which is show our humanity and our age. And quit normalizing and praising people to look the same and look ageless. So you arguably can't outbeat aging. You will just look like someone older who's had work done. And some people that are younger that have work done look older than they are, because of how inflamed it causes their faces to be. So that is my video for this week. I love you guys so much. As I always say, I hope you have a wonderful rest of your afternoon, I hope you have a wonderful rest of your morning, afternoon, evening, whenever you're watching this. And as always, je t'aime, bisous, bisous, au revoir, and abenteuer. Sha, sha, purpanaga, shaga, shaga, purpanaga, ooh, ooh, lali, lali, lali. Oh, I wish I could speak Russian. Maybe I'll add that to my resolutions. Oh, one final message. If you stay to the end of the video, you don't have to wait for a new year to change or make change in your life. Change starts by consciously choosing to be different, do different. So at any point in your life, if you feel like I need to change this, I want to do this, do it. 2026, anytime, any point, is all about acting on emotions and what you want to do. I love you.